Hello everyone, welcome to my office. Dr. Steph, a chiropractor based out of Grand Marais, Minnesota, and I've got your back. Today we're going to be doing some ground sitting, which is not too fancy, but just a simple way for us to work on hip mobility, flexibility, opening up our legs, and I've said it before, I'll say it again, the more that our hips can do their job, the less our lower back has to try to compensate for that. So I often see folks with a lot of low back pain, and it's because their chest is tight or because their hips are really tight and the low back is trying to do the job of the hips. So what we're going to do today is just some sitting on the ground, and we're going to spend 7 minutes doing it together. And you don't have to do exactly what I'm doing, but let's get started here. So we're gonna sit on the ground. I've got slippers on. I just have some space around me. I'm just in the corner of my office. You can do this in your living room. But get on the ground, wear clothes you can move in. And all that we're gonna do here, instead of trying to hit really specific shapes, we're just gonna keep moving. We're gonna explore this territory. So right now I have one leg out, one leg folded, and I'm just moving around, looking for spots that might be tight here. I'm feeling a little bit on my inner leg. So rather than trying to do one really specific stretch and holding it for a certain amount of time, I'm just exploring what's here. I noticed, oh, I reached for my toe and the back of my calf's a little tight. So spend a little time there. So you can be following along with me, or feel free to go off the rails. Try sitting a different way. Also noticing this leg that's bent. My hip's a little tight here. So I'm just gonna roll around on that hip. This is all it is. The first time you watch this video, you might be just doing what I'm doing, kind of exploring, but this is really just meant to be someone keeping you company, somebody to chat with while you do this yourself. Eventually you can just set a timer or look at the clock and just have some time sitting on the ground. Every day would be great. You can read a book, you can watch TV, pet the dog, hang out with your kids. I'm just kind of moving this hip back and forth here, trying to get into all the different angles of what this hip might need. But it's really good for us to have the ability to sit on the ground lots of different ways, to be able to get up and down from the ground, especially as we rack up those birthdays, as we age a little bit. It's a really important skill, really to think of it as a skill that we don't want to lose. So here I'm sort of sitting in a Z, pressing my hip forward, feeling a stretch on the front of my thigh. So I'm just going to lean into it a little bit. Again, there's no right way to do this. There's no wrong way to do this. We're just, I'll say it again, exploring. We're just exploring this little playground of what is it like to be on the floor. Sometimes we think, I can't hit this shape. I had surgery November of 2024, and my knees are not even. And instead of going, well, I can't do this, I better get out of here, I go, I wonder what it's like to move here. I wonder if I do this regularly, what might change? Where do I feel it being a little sticky, right? So instead of getting discouraged or thinking, wow, I can't do this, I'm not doing very well, I go, that's why I'm here. That's why we're doing this. And in a really expansive way, I'm just right now feeling different sensations in my hip sockets and going, what feels good? What feels sticky? Like when I'm flossing my teeth and I find a little something stuck in there. Okay, this feels a little sticky. Let me rock back and forth and see if I can open that up a little bit. But again, don't get stuck. Don't get static. Just move around and see what's possible. And do this regularly, and what's possible will change, will be different, which is pretty cool. So I'm just exploring this leg, feels different. I'm noticing as I lean over, I feel a little stretch in my low back that feels nice. So I'm gonna give that a little bit of time. I'm not staying anywhere too long. This might reveal my background and present as a dancer, but I'm not trying to like I said, make any beautiful shapes or gestures. I'm really just curious about what do I feel? What do I find? How can I help? How can I listen? So just let it be organic, different every day. But even if you just do this 5 minutes a day, 3 times a week, things will change. I try to do 10 minutes every day, but that doesn't always happen either. So again, there's not a perfect way for this to go. Just checking out this hip here. What can we do? What's possible? What needs a little stretch? Can I twist? I have this nice door here. Twist up against that. To borrow a phrase from the YouTube yoga instructor who's wonderful at Yoga with Adrienne, she often says, find what feels good. And I think that's a great directive here. We're just, what feels good? What feels possible? Kind of done a Z sit, sat with both my feet together. I'm gonna see what it's like to sit on my knees, how I get to my knees from being on the ground, right? But checking out that knee compression, is that difficult? You might just be still having some weight in your hands and trying to get your heels towards, or get your bum towards your heels. See what that knee compression is like. Build up to that possibly. See if you can use a little strength to push off. You can also come forward and see what the hip folding is like here. So from the side, I'm thinking about, can I sort of bend my knees all the way? How much of my hips can I fold forward? What's it like to explore that? We have just a minute left, so we're doing really well here. So I'm gonna swing these out and around. I got to practice some compression. I'm gonna sit with both legs out, really stretch out the back of the legs here. And instead of just, hitting a shape, I'm gonna wiggle around, explore a little bit, and feel there's so many different hamstrings back there. There are lots of different muscles, lots of different parts of the calves and everything, that as I turn my feet out, as I sort of point my toes out or in, how does that change the sensation? So I hope you feel empowered, encouraged, supported to just explore sitting on the floor. And then when it's time to come up, we've done our 7 minutes here. The best way is to try to get your weight close to you. So instead of leaving my feet all the way out there and trying to push up, I'm gonna bring my legs closer in whatever way I can, get my weight over my feet, use my hands if I need to, use something to push up off of. And again, try to keep my center over my feet as much as possible, and then you can push off. So thanks so much for hanging out with me on the floor. Maybe you want to stay on the floor a little bit more. Different every day, just something to explore and get to know, and watch what changes. If you have any other questions, feel free to reach out through my website, drstephvos.com, DrStephVos. And thanks for taking good care of yourself. Remember, bodies are meant to be enjoyed. I'll see you next time.